A 40-year-old woman comes to the emergency department because of renal insufficiency. She says that she has nausea, weakness, diffuse abdominal pain, and a tingling sensation in her arms and legs. Physical examination shows areflexia, serum potassium level 6.5 milliequivalent per liter. An ECG is done, which shows peaked T wave, prolonged PR interval, and a shortened QT interval. Which of the following is the most appropriate next step management? Here are the 5 options: albuterol, bicarbonate, dialysis, calcium gluconate, insulin. Now let's explain the answers. Albuterol is a salbutamol, which shifts the potassium back into the cell and is used after the risk for arrhythmia. It is used to treat high blood potassium level, asthma, exercise-induced bronchospasm, and COPD. Bicarbonate. Bicarbonate is an intermediate form in the deprotonation of carbonic acid. Bicarbonate helps the potassium to shift back into the cell and is used for the risk of arrhythmia and in the administration of calcium gluconate to stabilize the membrane. Dialysis. Dialysis is a process for removing waste and excess water from the blood. Dialysis is a treatment option for severe hyperkalemia in which medical treatment has failed to correct the underlying problem, with hyperkalemia greater than 6.5 milliequivalent per liter. Insulin. Insulin is a peptide hormone which is given subcutaneously via injection or as inhalation. Insulin shifts the potassium back into the cell and is used for the risk of arrhythmia and in the administration of calcium gluconate to stabilize the membrane. When arrhythmia occurs or when potassium level exceeds 6.5 millimole per liter, emergency calcium gluconate and lowering potassium blood level is the most appropriate management. The answer is calcium gluconate. And now I will explain why. Hyperkalemia refers to an elevated concentration of potassium in blood. Normal serum potassium levels are between 3.5 and 5.0 milliequivalent per liter. Levels above 5.0 milliequivalent per liter indicate hyperkalemia and below 3.5 indicates hypokalemia. Hyperkalemia is characterized by malaise, palpitation, and muscle weakness. Hyperventilation indicates a compensatory response to metabolic acidosis, which is one of the causes of hyperkalemia. Often, however, the problem is detected during screening the blood test for a medical disorder or after hospitalization for complications such as cardiac arrhythmia or sudden cardiac death. Kidney disease and medication are common causes. For diagnosis, the measurement of potassium is repeated and blood tests for cortisol, kidney function, creatinine, blood urea nitrogen, glucose, creatinine kinase are needed. ECG is obtained to determine if there is a significant risk of arrhythmia. With mild to moderate hyperkalemia, there is prolongation of the PR interval and development of peaked T waves. Severe hyperkalemia results in a widening of the QRS complex, and the ECG complex can evolve to a sinusoidal shape. When arrhythmia occurs, or when potassium level exceeds 6.5 millimole per liter, emergency calcium gluconate lowering potassium blood level is the most appropriate management. If you have liked the video, please hit the like button and subscribe to our channel.